Welcome everyone to the Spatializing Reproductive Justice Panzi Hospital by White Arkitekter program. I'm Jesse Lazar, Executive Director of the Center for Architecture here in New York. This program is presented as part of the Spatializing Reproductive Justice exhibition at the Center for Architecture, on view currently through September 3rd, 2024. Spatializing Reproductive Justice is a traveling exhibition and programming series that aims to spread awareness of the inequities of reproductive care in the United States and the agency of design fields to expand access. Learning from past and present reproductive and sexual health justice movements, the project addresses the spatial, legal, and social logistics of reproductive healthcare access in the United States after the repeal of Roe v. Wade. Today, we're thrilled to hear from Christiana Kyra, architect and board member at White Arkitekter, and Agnes Orstadius, architect at White Arkitekter, about their work on the Panzi Hospital project. We'll also be joined by one of the curators of Spatializing Reproductive Justice, Lori Brown. Lori Brown's research focuses on architecture and social justice issues, with particular emphasis on gender and its impact upon spatial relationships. Her work seeks to broaden the discourse and involvement of architecture in our world. Her two books include Feminist Practices, Interdisciplinary Approaches to Women in Architecture and Contested Spaces, Abortion Clinics, Women's Shelters, and Hospitals. She is the co-founder and leads Architect XX, a women in architecture group bridging the academy and practice in New York City. Her current projects include Birthing Centers, Borders and Bodies, and the Bloomsbury Global Encyclopedia of Women in Architecture, 1960 to 2015, with Dr. Karen Burns. She is a 2021 Architectural League of New York Emerging Voices recipient and a registered architect in the state of New York. And now I'm pleased to welcome Lori Brown to the virtual stage.
Thank you so much, Jesse. It's such a pleasure to be here and to be in conversation with Christiana and Agnes. There's one I want to just mention in terms of the exhibition, that this was originally work that comes from three studios, my own at Syracuse University, Lindsay Harkamet at City College, and Brian E. Roberts at Columbia. And because of the amazing experience we all had, we thought that this definitely needed to have another light of day and iteration. And we are so thrilled that this became an exhibition and is now at the Center for Architecture. So it is a pleasure to introduce White Arkitekter and Christina, Kara, and Agnes Orstadius. White Arkitekter was founded in 1951 in Gothenburg by Sidney White with the aim to improve society through architecture. His legacy lives on in their ambition to contribute towards a more sustainable world. The ideals of collective thinking and employee ownership are as strong as ever, and today they are one of Scandinavia's leading architectural practices with about 700 employees and have presence in Sweden, Norway, the United Kingdom, Germany, Canada, and East Africa. They are collectively owned, and about 77% of their staff members, 117 of whom are partners, and they work together to benefit society as a whole. Their project is included in the exhibition, and so I'm very excited to hear more from them. That the project is in Bakurou, Democratic Republic of Congo, providing maternity care and treatment for survivors of sexual violence. So with that, I turn it over to Agnes and Christiana. Welcome.
Thank you very much, Lori, and thank you, Jesse, for the introduction. I will start the presentation, and then also Agnes will present part of the slides. First of all, Panzi Hospital. Some of you may know what it is and where it is, but otherwise I will just give a short information about the Panzi Hospital. The hospital was founded in 1999 by Dr. Mukwege with the support of the Swedish Pentecostal Mission that is present in Congo since 1921. The hospital specializes in treating survivors of sexual violence, particularly conflict-related sexual violence. Director Denis Mukwege has been operating on survivors of sexual violence for years, for decades, together with his engaged incredible staff. Dr. Mukwege has been recipient of the UN Human Rights Award in 2008, the Sakharov Prize in 2014, and the Nobel Peace Prize in 2018. The healing model at Panzi Hospital is based on 4 pillars. This model meets the full spectrum of needs of survivors of sexual violence. Panzi creates a safe space that supports physical healing, emotional recovery, rebuilds the women's livelihoods, and contributes to the long-term sustainable restoration of their community. So I'm just running through. The location of the hospital is in the Democratic Republic of Congo. The region is called South Kivu, and Panzi Hospital is located in the city of Bukavu, just by the river that is between the Kivu region and Rwanda on the other side. The project was developed in an amazing multidisciplinary team, where White is one part of the Hospital of Panzi, of course, and the University of Gothenburg with researchers and professors in midwifery. The Art of Life and Birth, which is also an association working with midwifery and birth research on birth and delivery and neonatal care. Chalmers University of Technology, where we have this year Laurie Brown as a Jubilee Professor, was also involved in the project, especially in the development of the design dialogues at the beginning of the project. And WSP was involved in particularly with the knowledge on technical infrastructure. The project was developed in a few years, starting with the involvement of Panzi Hospital, the University of Gothenburg, and Art of Life and Birth in 2015, defining the vision of the project and the mission. And later on, Chalmers and the Center of Architecture, where I work half-time as professor in healthcare design, started working later with the design dialogues, and as the next step, White Arkitekter and WSP, together with local architect, continue the work, translating the vision into a feasibility study, first of all, master plan and feasibility study, and later on, the final report. The project also continued after 2018. We will not show in this presentation, since of limited time, that the project has been developed further, and also we have worked with an updated master plan. So first of all, the master plan. When we started with this project, the ambition of Panzi Hospital was actually to build a new mother and baby clinic, but we realized quite early that it was necessary to have a holistic plan for the whole plot before starting the deep dive work with the feasibility study of the mother and baby clinic. This was necessary to be able to create a more sustainable vision for the site, and also a better future-proof solution for the mother and baby clinic. So in use for 25 years and placed in a city that grows extremely much with a very young population, Panzi Hospital needs to increase its size and services. And the current facilities need a general review due to suboptimal flows and logistics and overcrowding in general in the wards, and lack of functional technical infrastructure such as sanitation, water, and electricity. The new master plan aims to develop the hospital based on Panzi's patient-centric care model, and develops the hospital in several phases. We have been working with the analysis of the existing conditions, looking very closely to the current shortcomings, then developing the proposal and the sustainability strategy. And these are a few images from the master plan, and it is, of course, a quite extensive material. But what we have done in the proposal is to try to look at the hospital structure that from the beginning was actually only these pavilions here in the beginning. But we have also seen that there have been additions to the existing structure throughout the years, and these additions have not been made with a holistic planning at the ground. So they quite make it difficult for a hospital to expand. Therefore, we wanted to take this holistic view first of all, and also the services have been moving around, as it is quite usual in hospitals, even in Europe, that services develop and are moved around, and then the flows do not work efficiently anymore. So we have been trying in this proposal to regroup the services so they are better connected to the site. So what the yellow that you can see here are the consultation and outpatient departments are located closely to the entrance. The wards are closely connected and placed in the existing pavilions. And the more critical functions of the hospital are located in what you see in the green color in the center of the site, well connected to the emergency entrance. The phasing is split in three parts. The first phasing will be the development of the new mother and baby unit, which is number one. And in the second step, a new operating theaters unit located in the area marked with number 2. And then as the third step, there will be the opportunity to renovate the existing buildings at the site. So when it comes to the mother and baby unit, it is going to be the first phase of the development of the master plan, and the feasibility study and the concept design are based on a scientific, patient-centered, and holistic care philosophy. The idea of Panzi is to develop a model for other maternity and neonatal care facilities in similar contexts in both the Democratic Republic of Congo, Africa, and the rest of the world. The current situation, we can say that maternal care and neonatal care are very important parts of the services of Panzi Hospital, but many women do actually arrive to the hospital too late after having started labor in another facility, or unfortunately many of them at home. And some of them have developed complications that are quite severe, and the number of cesarean sections is extremely high at Panzi Hospital. The same occurs for babies. A lot of babies are born elsewhere or at Panzi and with complications and are then brought into Panzi Hospital. The current situation is severe. There is a lack of space in the delivery unit and overcrowded postnatal wards. The delivery rooms are not appropriate for personal integrity and privacy. There is no opportunity of co-care on mother and baby, and no opportunity actually for the mother to stay close to their baby in the NICU department. Very difficult for family members to stay close to mother and child. The distances between the NICU, the delivery unit, and the operating theaters are big, and actually quite difficult when it comes to patient safety. Sanitation is insufficient, and the access to water and electricity is not secure. And all of these factors create substandard work conditions for staff. They do not actually enable staff to work and deliver optimal care according to the existing scientific evidence and the way the Panzi Hospital actually wants to work with patients. So what we did was to work with evidence-based design as a process, and I usually take this definition by Hamilton as the most relevant for our work, since we worked with a process that was relying on current best evidence for research and best practice, but also very close connected to the contextual needs of the users through design dialogues. So in this project, we had the amazing opportunities to work with researchers and midwifery researchers. So we could really apply the knowledge, scientific knowledge on patient-centered care for mothers and babies, and translate it into a building where we also applied current scientific knowledge and best practice when it comes to health promotive architecture. We apply the principles and the experience of climate adaptation, resource efficiency, and future-proofing principles, and continuously through the whole process from visioning to the completion of the project, anchoring the ideas and the principles with the community and the cultural and organizational context. These are a few pictures of the design dialogues that we have had from the visioning through the design of the floor plans in a continuous way throughout the project. And this is one of the maps that the midwives and the mothers created when we started the visioning of the brief. The health promoting architecture is, of course, the principles are based on literature and scientific evidence, but we also had workshops on this specific topic to understand the quality proof if these principles are applicable and still coherent with the culture of the community and traditions. And we have been talking quite a lot about attractivity of architecture and what it means, an attractive environment, a welcoming hospital, easy orientation, the graduation between private and social spaces, and the access of to daylight. And when it comes to building with climate, this is just a picture of the room where we were at that time, sitting in a team with Agnes and other team members, collecting relevant practice and also a lot of literature about working with this very special climate that the Democratic Republic of Congo has in Bukavu, and Agnes will tell us more about it. But also working with the local engineers and architects that are actually currently designing and working at Panzi to understand the quantity of materials, the access to building materials, the building techniques to make a project that is really anchored to the site. So working on the core principles of the project, the main goals have been to reduce maternal and neonatal mortality and morbidity, creating optimal flows in short distances, possibility to do cesarean sections in the delivery unit, and making the emergency flows reach directly delivery and neonatal unit. to secure personal integrity and safety and work for zero separation of mother and child, putting the delivery unit and the NICU in direct proximity, and also enabling in the brief development to have co-care of mother and child and small wards with patient rooms for 1 to 2 mothers. Also supporting or enabling the continuous support of a non-professional person, like the father or a family member of a doula. And this is also, once again, impacting very, very much the brief of the building, creating space for companions in all patient rooms, family areas within the unit, overnight space for relatives and supportive persons. Working with health promotive care environment, creating a welcoming and attractive environment, access to daylight, views of nature, good indoor comfort when it comes to temperature, ventilation, humidity control, noise reducing finishes, easy wayfinding, and of course, good technical systems that are reliable. And these have an impact on the work conditions, where we focused on creating efficient flows, short distances, staff areas with qualities, and a robust and sustainable buildings. I will now let you, Agnes, continue with the presentation.
Thank you, Christiana. So diving into the physical form of this incredible project, we start with reiterating what the site of the hospital looks like. Across the river, you see Rwanda. And when you look at the site footprint, you can almost sense the rapidly expanding urban context around it. So the site is one of the remaining green lungs in this area, which made it really important for us to try and keep the footprint of any new development small in order to preserve greenery. The purpose of the project was to consolidate all care relating to mothers and newborns in one environment, and to make this easily accessible and oriented. And so we started out with one entrance square and 2 central axes running from it that were clearly visible from the entrance. And around these main streets, so to say, the program was organized so that all of the functions that needed these short distances and close connections were located on one entrance floor, with less urgent functions on the upper and the souterrain floors. And within this structure, we worked with different sizes of atriums that were proportional to the heights of the buildings around them, to bring in greenery and daylight into this fairly compact structure. We also worked with the roof shapes, optimizing them to the prevailing wind direction, enabling collection of rainwater and supporting natural ventilation. And the public squares and the public streets were given this distinctive timber structure roof to further ease orientation throughout the structure. So looking at the site plan, you can see the main entrance to the hospital towards the top of the plan, and the new mother and baby unit in the east. So this entrance square of the new mother and baby unit is oriented towards the main entrance. And you can see that we've densified the site rather than creating an expansive footprint and losing greenery. Delving into the floor plans, if we start at the entrance floor, by the entrance arrow, and the number 1 is the large covered entrance square. And the building closest to it, number 2, is the most outward facing part of the program. It's the consultation part, the antenatal outpatient department with consultation rooms. So that's oriented towards the rest of the hospital and the entrance. And leading off of this entrance square are the two streets, where the upper one leads through a series of postpartum pavilions in 2 floors, where healthy women and babies recuperate after the birth has taken place. And the lower corridor leads to the neonatal unit on the left, and the delivery unit on the lower right. And the neonatal unit contains cubicles for treating newborns, but crucially, it also contains this space for the mothers, which has been lacking, so that they can always stay close to their baby being treated. And the delivery unit on the lower right contains 10 delivery rooms and also 2 operating theaters for cesarean sections, which, as Christiana mentioned, is a very common procedure. And to the bottom, leading directly into these units, you have the emergency entrance, which is also easily reached from the ambulance bay on the left, coming off of the main entrance. On the floor, moving away from the entrance floor, we see the upper levels of the postpartum pavilions. And located on this floor are also spacious classrooms, which we found a need for also for the rest of the hospital. And above the entrance square, accessible by a ramp, we have a kitchen area for relatives and patients. And one crucial difference from designing this program in Scandinavia is the increase of presence from relatives of the patients who accompany the patients and on longer stays to support them and cook for them and so on, since no central cooking is provided at the hospital. Then on the floor below the entrance floor, we have placed accommodation for these relatives, support functions such as storage, laundry, and sterile units, and also staff units. So this is the view when you come in from the main hospital entrance. This is what greets you. This open structure leading you in and welcoming you to the new mother and baby unit. This is an image from inside one of the delivery rooms, which, as you can see, faces onto an atrium, bringing in plenty of daylight and views of greenery, and which provides ample space for the mother, but also space for the supporting relative and the mother's companion, in a dedicating niche for sitting or sleeping. And you can also see the door to the bathroom, which is shared between 2 delivery rooms. This is one of the gardens between the postpartum pavilions. All of the postpartum pavilions face out onto these gardens, which provide greenery and daylight, and also plenty of space for calm social activities. And here you see the kitchen area for the relatives and patients above the entrance square, with the space and facilities for cooking and space to spend time with your family and your supporting relatives. And this is a view from inside one of the classrooms, where you have space for learning activities, both for the becoming mothers, but also for other needs within the hospital. And the architectural intention of the project was to create a building that has a distinct identity in the materiality, but also one that also breaks down the scale to be welcoming and to be approachable. And there were several reasons for keeping the structure quite low, even though we wanted to densify the site and minimize the footprint. One is to let in as much natural ventilation and daylight as possible, and the other was to not rely too much on mechanical technology for vertical movement, such as elevators, so that all of the building would be accessible through ramps. As Christiana mentioned, the access to water and electricity can be intermittent here, so we wanted to make this structure as robust as possible. You can also see in the upper section that the tallest building of the site faces towards the main road, which signals the presence of the project to the surrounding area. And as a foundation for the design work, in choosing which architectural strategies to work with, we did a fairly thorough study of the local climate. So on the left, you can see a graph plotting the annual average temperatures and relative humidity across the year in the site. And Bukavu has a pleasant climate. It's very, very lush and green. It has a lot of humidity, and it's located very high up, and the elevation makes it not as hot as could be expected. It gets quite cold in the evenings. So This combination provided suitable conditions for using both the strategy of natural ventilation, but also passive solar heating with the materials of a high density that collect heat during in the sun and then releases it during the night. And in addition to this climate research and mapping, we also tested our designs with simulations, tweaking the form to optimize for wind and orientation. So this is how these architectural strategies turned out in practice with these pitched roofs doing a lot of the work. As we mentioned, water can be a scarce resource, and so we devised a rain collecting system from these pitched roofs, and we also used these sort of heavier material brick to store heat during the day, and the pitched roof also helps ease natural ventilation through the building, creating a pressure difference on both sides of the building. Which makes the dependency on mechanical ventilation much lower. We also did a lot of research on resource efficiency and tried to use local materials and local building techniques to the greatest extent possible. We used a lot of bricks, which is produced locally, and timber, which is also found nearby, so to speak. We tried to minimize the use of concrete and steel because that has to be imported, and we also minimized the use of ceramic tile. So we let the material palette be very influenced by materials that are already commonly used in the region. And we also worked a lot to future-proof the building. The entire floor plan is based on a very tested grid that has proved to be adaptable towards future needs, so that should you need to remodel the hospital in the future, you hopefully the need for demolition is minimized, and the structure can be reused. We also looked at earthquake resistance using local building techniques to stiffen the buildings and create even loads and a robust structure against earthquakes. And although it was a feasibility study, we wanted to make sure that it was actually practically feasible to build these structures. And so we went quite deeply into designing the construction of the building and looked at the local construction methods and reused a lot of the methods that have been used to construct the existing hospitals, but updating them according to our finds in terms of what worked best for the climate and what could make the hospital as robust and as technologically independent as possible.
Yes, so when this part of the feasibility study was concluded just 1 year after it became official, we were actually waiting for Dr. Mukwege to connect to a Zoom meeting to discuss some part of the design of the building, and then we realized that he had won the Nobel Prize the same day. So this has been, of course, an amazing recognition for Panzi Hospital for the work that they are doing for women and women's rights in the region. And also he has taken the opportunity to talk in many different global conferences and networks on this topic, because it is unfortunately not only a topic for Congo. What happened afterwards is that the project has been receiving a lot of international attention. It has been featured in many different magazines and architectural publications. It won also prizes, such as the World Architecture Festival in 2018, and we have also published a few reports that are available on our webpage to be downloaded. The most recent dissemination was last year in 2023, last summer in July. There was the Union of International Architects Congress in Copenhagen. And in occasion of this Congress, most of countries had their exhibition, and they showcased interesting projects from their the different countries. And the National Association of Architects of Congo had the project featured in their exhibition without actually talking to us at White. So we were there, and all of a sudden, walking in the exhibition, we found our project featured by the National Association of Architects, and they had featured just a couple of projects in modern architecture or contemporary architecture from Congo, which for us means a lot, because it really means that this project has been an inspiration for new generations of architects in Congo. And I would like just to conclude with this quote, because it was the quote they chose for the exhibition, that White designed the future Panzi Hospital with the mission of enabling the reintegration of women victims of rape in society through the art of sustainable architecture. Thank you very much.
Thank you so much. It's such a beautiful project, and it was really great to hear how it evolved in the process. And I want to invite those of you who may have questions while I begin the Q&A, please feel free to post them within the Q&A section on Zoom, please. So we welcome audience engagement. But I'm happy to start us off while we're waiting for some of the audience to think about what they'd like to ask. And because I had the good fortune to meet you, Christiana, just last week, which is kind of amazing, and becoming aware of some of the things you're working on, can you both talk about the influence this project and the process of working on this has in future and ongoing and future work, and what you've gleaned from this process and ways that you're applying and testing it in some of the projects you're working on today?
Yeah, so for me, this project is of course has a very strong focus on the how architecture can provide the most optimal frame for a good delivery, a birth, and the connection between mother and baby. As designer, it was one of these fantastic occasions where you manage to work very close together with the service providers, which is Panzi Hospital, with the mothers, but also with researchers within this field. So the opportunity to work with professors and researchers in midwifery has given this project an extra dimension, I would say. And after this project, or this phase of the project, we started a new study, a new research project, this time in Scandinavia, actually in Sweden, where Professor Marie Berger was a researcher in this, also in this constellation in the Panzi project. She also initiated another research project where that is called the Room for Birth, and where we researchers from the Center for Architecture at Chalmers also participated too, and it was the development of a new delivery suite, a new delivery room that is a prototype for a completely different type of delivery room that has been built within the existing delivery unit and used for 3 years. And there are now documented and published results of this prototype, how it has actually worked both for mothers and their companions as well as for staff. And these studies are now being used, or the results or findings are being used for the modeling of a new mother and baby clinic at Sahlgrenska University Hospital that is in construction at the moment. So it's quite interesting how this project that was in a very different geographical and cultural context has been followed later by a project that is here by us, very close to our office here in Gothenburg, and it is being built for the moment, inspired to these principles. So it's a kind of, every project is an opportunity to develop new knowledge, and then to bring this new knowledge into a new project that comes after. So that is for me quite amazing that it's and it's, yeah, it is the what makes this work and this profession so very interesting.
Mm-hmm. I don't know, Agnes, if you have anything you'd like to add to that.
Absolutely. I would absolutely agree that every project is an opportunity for a learning experience, but it's not often that projects are that learning becomes so explicit as it does here, where you have both practitioners from very different fields and people from different professions and different cultural contexts, speaking different languages. You have to be very aware of your own sort of communication and your methods, and be able to explain them quite well. And that has been incredibly very valuable in I think making us aware of our how we work and what how do we present our design in a convincing way and so on. So I think that it's really brought light onto all of our practice after we did this project.
Thank you. So I did spend some time looking at the publication you made that you had recommended. And one thing that really struck me, because I've been thinking a lot, especially in my teaching, about UN Sustainable Development Goals, and there was something mentioned in your publication about how this project is contributing to the change from a philanthropic model of care to one of a more empowered development model. And can you speak a little bit more about that? Because I think that's a really important thing for all of us to be thinking about in terms of who and why we serve different communities in ways that can extend and create, say, more resiliency in the future of what is being built and made.
Yeah, so the first impression when we started this project was that next to the existing pavilions that had been built from the beginning, 1999, there had been a few additions, a few new buildings. They had, the name of the donors on, and these buildings are, for me, a physical representation or a physical symbol of this philanthropic way of supporting, unfortunately, many different countries or communities. Buildings that are placed to manifest philanthropy, but that were partly not used because they are placed in the wrong place, they are too big or too small, or are provided with technologies that require a lot of electricity or a lot of IT that is not existing on site. There was very advanced dentistry equipment, and there were cots for premature babies. They were just standing in corners, not used because there is not enough electricity on site. So philanthropy can be manifested in architecture, and what this project goes in another direction because it is an initiative taken by Panzi. They need to develop a better hospital, a more resilient hospital when it comes to technical infrastructure, but most of all, they need more space to provide more services for the local community. And the local community can actually pay their fees, because there is a growing middle class in Congo and in Bukavu, but they cannot go to this hospital because it has so poor conditions. So the idea of the management at Panzi was that expanding the hospital and also renovating the existing hospital, they can provide more services. They can attract fee-paying patients so that they can become self-sufficient and build up a more economic, sustainable future, but also in the same time provide free of charge healthcare for the more the patient groups that they take care of as well, that cannot pay fees for healthcare. So I think it's a bit of a different approach, and it's much more from a bottom-up initiative, and the building tries really the design of it also to be more a bottom-up initiative that is taking care of the whole site and trying to provide or to keep as much of the greenery and the quality of the sites intact, and to make an addition that is compact, but on the other side also so very well connected with the holistic plan of the site. So I would say that it is a clear plan by Panzi to become self-sufficient, and they are not at that point when we did the feasibility study, they were not supported by the state. So they have to develop their own business model. And the business model was to expand the services and provide services that are attractive for a growing middle class in Bukavu.
We have a few questions in the chat, but based on what you just said, I do want to follow up with one other question, because you talk about it being in part a ground up process and project. And so can you speak a bit about how the participatory process provided unexpected insights or ideas about what was needed, or in some ways what you ended up proposing that you would not have thought about otherwise, but it was because of the participatory model that you used, that you gleaned, there were certain insights gleaned that maybe would not have been possible. I don't know if there's anything that comes to the top of your mind about that.
Would you start, Agnes, with this?
Well, the first thing that comes to mind is the universality of the birthing experience. That what we realized from these workshops was that, and I mean, this is not surprising, but it was a good reminder that what every sort of mother giving birth needs is quiet and support from her companion, that access to greenery has a healing effect, this separation between public and private spaces, that this is very important. And so that all of these experiences are sort of universal, independent of cultural context, was something that was really reinforced in this design dialogue, I think, and really informed the design afterwards.
Of course, it was also the very important presence of the relatives. We cannot really compare that because they don't provide food, they don't wash clothes either, the laundry. So the relatives, they follow the mothers to the hospital and can stay there for weeks with the siblings or with other children as well. So there is a need of, the hospital is almost like a small community or a small city where all these extra relatives need to have places to sleep or to cook their food or to make the laundry and dry clothes, etc. And this is something that is slightly different from Europe. although we see in Europe more and more that the presence of relatives and close by is growing within healthcare facilities, partly due to staff lack of staff, but also because working more on a patient-centric healthcare model, you really see the advantages of having the relatives or the friends staying in the hospital with their loved ones, and that is actually supporting better recovery and well-being. So even in Scandinavian and European hospitals, there is a growing presence of relatives in the hospital setting as well. So it's something that we might get inspiration from Africa in the future.
That's great. So I will, there's two questions that I think can be in some ways combined. One was asking about if you could talk about the circulation between the two floors. And another question was asking about the high rainfall and your decision to keep a lot of these spaces open to the sky, and concerned or wanting to understand what kind of effects that has for the patients if there's potentially more rain coming kind of into these more public zones of the hospital.
Yeah, I will start, and then Agnes, maybe you can take the rain issue. So when it comes to the levels, the building is placed on a sloping plot. So we had to work with this souterrain. We have a souterrain floor that we show there. Agnes will show you where we actually placed functions that are supporting functions, but do not need to be very on the same level as the rest. And then there was quite a lot of discussion about the postpartum wards pavilions, because most of pavilions in the hospital are only one floor. And there is a challenge with elevators and with electricity that they are not 100% reliable. So if we would have built pavilions on one floor, the footprint of the building would have been increasing quite a lot. So in the discussion with Panzi Hospital was very keen on keeping the greenery in the south of the plot, very, very much, because it is a lung for the whole area. So the compromise was done to say that patients are in worse conditions will be placed in the ground floors, and patients are feeling better. They are placed on the upper floors, and there is a quite generous ramp so that you can actually reach the upper floors with wheelchairs or even for patients on bed. So they are not depending on mechanical transportation systems vertically. And then, of course, there is an issue with natural ventilations, because it is easier to work with one-story pavilions, and these streets that we have in our building are actually, even in the existing buildings, the existing structure is made of bricks and pavilions with open streets connecting them with just roofs, but otherwise they are outdoors, and this works very well in the climate of Bukavu. And of course, there is a bigger challenge when you work on two floors for natural ventilation. And therefore, as Agnes said, we had studies, very specific studies on wind simulations, so that we could actually decide how large the courtyards need to be and where they need to be, in which direction, if south-north or north-south. If you notice, our courtyards are directed in the other direction than the existing ones. This is because we have been studying the natural flow of the prevailing winds in the area to get this natural ventilation to work as good as possible in the pavilions. And regarding the rain, Agnes, I think
Yes, exactly. It's true that there's a lot of rainfall here, and that's why we made all of the public space, the entrance plaza and the kitchen areas and the main streets, so to say, into covered. It's open, but it's covered by this wooden canopy. And in terms of the courtyard, there is this balance, as Christiana was saying, between letting daylight in and letting wind in, and thus decreasing the dependence on mechanical lighting and mechanical ventilation, with the want to cover it to provide more space that's also accessible to the rain. So there was a bit of a balancing act there, but we opted for making all of the communications covered and making the largest public spaces covered. You can see the entrance square here to the delivery unit and the neonatal unit in this image, and the space is partially covered and partially open. And we worked with a technical consultant, the VSP, who devised a scheme for collecting the rainwater in tanks to be able to reuse it for different uses across the hospital, so that it would make up in part for the lack of access to clean water on the site.
Thank you. There's another question wanting commending you on the really nice presentation and project, and asking what are the next steps for the project?
Yeah, so after the Nobel Prize ceremony, there was, of course, a lot of international attention on Dr. Mukwege and Panzi Hospital. So we received we were involved in an update feasibility study. There was a bit larger brief because Dr. Mukwege thought it would be a good opportunity to use this kind of celebrity period to collect even more financial support for the building. As far as we know, there is capacity study being done currently by the World Bank to see to more or less analyze more the business case part of the project in order to continue and actually go into the more implementation of this building project, which I think is very good because, of course, the business model is the key, as we said before, to enable a more sustainable future for the Panzi Hospital, given the conditions of the country. So that is the step that we are expecting the project to go. The project has been also, Panzi Hospital wanted to use this feasibility study to get international attention on the project, and the fact that the World Bank is involved is a positive step in the right direction.
Mm-hmm. Thank you. It's amazing to think about just the lifespan of what you've been working on, and sometimes how long projects take from initial interest, conception, all the way to potentially building and construction, and then
in this case, it's not a big difference to European projects, I would say, because the public projects.
Okay.
I mean, we are, I think in the UK, they usually talk about 7 to 8 years from the first idea to the completion of a healthcare project. So it takes a lot of time because the projects go in different steps, and they need to have approvals, and they need to have financial approvals, and different stages of economic estimates, etc. So it's not unusual that the healthcare projects require a lot of years to be implemented.
Okay. Well, there's no more remaining questions, and we are at time, but I also want to thank you so much for your willingness to let us include this project in the exhibition. It's really important that we wanted to include work from practice to show how different places around the world are engaging issues around reproductive health care, and having these amazing models as examples that are just quite exemplary. So it's an honor to be able to include your project and to be in conversation with you today. And I look forward to being in conversation in the fall when I return back to Gothenburg.
Yes.
So thank you so much for spending time with us today.
Thank you very much, and we will make the presentation available. So if anyone has questions or comments afterwards, you can always reach me and Agnes by email.
Great. Thank you. And thank you all of our participants as well. Have a good day.